Hello, Dr. Pranaya here. Today we are going to discuss few common frequently asked questions by patients regarding hair transplant. Next is, if I have migraine and headache, can I undergo hair transplant surgery? Migraine attacks can have lot of issues, as we all know. First and foremost, identify the trigger. If you feel during the surgery time or near to the surgery time you have migraine attack, better to postpone the surgery and schedule it when your migraine attack is over, because during surgery we are giving anesthesia, you will have little bit of heavy headed feeling or some uneasy feeling. So migraine attack along with your surgery won't go hand in hand. So better you take care of your migraine first, and then after you are alright, you can continue with the hair transplantation surgery. Then you can post surgery, you can take care of it better way. Next is how to do the head wash after the surgery. Some people say after 5 days, some say 7 days, some say 10 days and 12 days. So yes, head wash after surgery. So some people advise it immediately after 3 days, some people advise it after 5 days, 7 days or 10 days. So this 3 to 12 days time, why it is so? After hair transplantation, initially for 5 days you have medication. At the same time, for cleaning your donor area, you have certain antibacterial solutions and cream to apply. You have normal saline or ringer lactate spray to spray on your implantation area. After 5 to 6 days, you have to do the baby shampoo wash of your scalp just to cleanse it properly, but do not rub it that way. So what determines to be done it after 3 days or 5 days? If your scalp is clean, normal scalp which doesn't have much oiliness, greasiness, or which is not having any flaky thing on the surface, you can wash it immediately after 3 or 4 days also, that's not a problem. But when you have dry scalp, when you have oily scalp, when you have dandruff tendency, 5 to 7 days you have to keep taking care of it properly with the antibacterial lotions and shampoos and other thing, and then you can go ahead with the anti-dandruff treatment. So ideally, if you have to say 7 days is the ideal time to do the head wash, you can either prepone it or postpone it depending upon your scalp condition and depending upon how your post surgery time is. Then they asked why to avoid spicy food after hair transplant. See, we always tell that you have to have a balanced food. At the same time, we advise you not to take spicy junk food or oily food, because whenever you have that more, you have tendency to sweat. So whenever that tendency to sweat is there, the sweat will remain on the surface of the scalp, and that is harmful for the environment onto the scalp for the growth of hair. That is why we ask you to avoid. At the same time, we even advise you not to go to gym or swim, and we ask you not to vigorously exercise or massage on the scalp. It's for the same reason, not to traumatize that area in any way that the hair roots are damaged or any time the scalp is getting infected. So all such things are to be avoided. Then what are the complications due to dandruff in a patient who is undergoing hair transplant? So if you are planning to go under hair transplant, you have decided to undergo, get yourself treated for dandruff. You can see a dermatologist around you and you get it treated with proper medication, shampoos, lotions, whatever is needed at that time. Because during surgery, an infected or inflamed scalp can give rise to bad results. So your donor area has to be clean, your implantation area also has to be clean. And when you have a tendency for oily, greasy and scaly thing on the scalp, you have to understand that post care surgery is very important. So that also you have to follow up regularly. Is there any problem arise after hair transplant like weight gain or weight loss? No. Weight gain or weight loss is not related to hair transplant as such, because we are not giving any medications or any injections or anything that is actually going to give rise to weight loss or weight gain. What are side effects if I have high BP in hair transplant surgery? So if you have high BP, it's a medical condition, hypertension. If you are on medication, there is a chance that you may have to change your medication before surgery or even after surgery, so that your blood pressure remains normal. That is a high risk surgery actually when you have high blood pressure. So before surgery, our anesthetist can check and they can advise you what medication to change and how you can go ahead with the surgery. So it is advisable to get a medical fitness also done if you have any medical conditions associated before hair transplantation itself. Then how much time it takes for hair transplant result? It's a common question. As I said, 3 months is the shedding time, 6 to 8 months usually we see results, but at times some people, their rate of hair growth is takes longer time. So even up to 8 to 18 months is the time that we could see the hair growth. So at this period of time you have to keep observing the hair growth, keep taking care of it, and whatever supportive treatment you can do, you have to get the treatment done. Then when to start PRP after hair transplant? After hair transplant, PRP is given as a supportive treatment to make your hair grow in a better way, and it also helps your other areas of the hair which are going thinner to prevent the hair fall. So immediately after surgery, within 2 weeks time, as early as 2 weeks, you can start PRP and keep maintaining it as once in a month therapy. So initially 4-5 sessions we advise. After that, as you feel, you can continue at least 3 sessions in a year or 3 to 4 sessions. So minimum gap of 3 to 4 months you can do 1 session of PRP and continue it. So these were all about few doubts that a lot of our patients used to have regarding hair transplantation and related things. If you have more doubts, you can put it in the comment section. I would like to answer that, and we'll come again with few more informative videos with hair and skin related problems. Thank you very much. Keep watching.